The primary goal of hospice care is to achieve comfort quickly in response to the progression of a patient's condition as their pain and discomfort escalate. One of the tenets of hospice is vigilance, and always being prepared to address the potentiality of increasing pain and discomfort as the patient's condition worsens. Another tenet is ensuring the patient's environment is comfortable, private, and secure, and doing our utmost to preserve their dignity, privacy, and sense of well-being. This environment could be their home, a family member's home, a quiet area at the facility they reside in, or in some cases, an inpatient unit. Protecting the privacy of our patients and their loved ones at all times is always a priority. Hospice relies on various disciplines working together to deliver the tools and processes essential to achieving the goals discussed earlier. While hospice treatment may occur at many locations, hospice itself is not a place. Instead, it is a philosophy of care that requires a team of professionals trained to treat and minister to a person's needs during the final steps of their life's journey. Each team member brings different skills and expertise to the hospice team. The leaders of the hospice teams are the hospice physicians who have advanced training in the care of hospice patients. They work closely with the hospice team members to design, execute, and oversee a plan of care tailored to each patient's specific needs. In addition, the hospice physicians take a hands-on approach in managing the other members of the hospice team. They remain available to the patients and their caregivers for advice and consultation for the duration of care, whether 6 days or 6 months. Nurse practitioners have much in common with registered nurses. Both work closely with patients to monitor their health and provide medical care. However, NPs have an advanced degree and more training, which gives them greater autonomy and expands their responsibilities. For example, duties customarily performed by physicians such as creating individual treatment plans, evaluating medical and test results, and prescribing medications. In addition, they often manage other nurses and medical staff. Registered nurses' primary role is to assess patients, identify their critical needs, and implement medical plans. RNs have a more hands-on role and spend much of their time performing tasks like administering and monitoring prescribed medications, IVs, and other treatments. They also help educate family caregivers on how to provide the very best care to their loved one. Your registered nurse will also be your resource to reinforce what you learned in hospice school and to serve as your first responder and your sounding board. In addition, the hospice program keeps a registered nurse on call 24/7 for quick consultations. Both nurse practitioners and registered nurses make scheduled and ad hoc visits to monitor the patient's condition and care plan. Hospice aides also make scheduled visits to assist with patient mobility, transferring, walking, dressing, eating, grooming, toileting, and bathing. Social workers will review your case and identify psychological, social, and emotional factors that may be impacting the patient's health and well-being. The social worker is also there to help with counseling and grief support. The social worker can also assist in finding community resources for families, caregivers, and patients. Spiritual counselors are available to offer spiritual advice if desired. They can also help coordinate with a clergy person of your choice and religious affiliation at your discretion and need. The spiritual counselor can also provide grief support services and assist in finding community resources for family and caregivers. Our pharmacy will keep a formulary of curated hospice medications to help you achieve comfort and relieve symptoms. It also supplies and delivers all hospice-approved medications to your location at no cost to you. Caregivers may make special requests for other supportive services, which we will try to provide as long as they conform to hospice care goals.